I'm Jerry Block. I'm a medical doctor. I practice in Tulsa. The reason I come to practice every day, I'm 74 years old. Don't need to make any more money. I was very fortunate in my previous life. I did very, very well and put some money away. But I love what I do, so I do what I love. 25 days a month, I see patients. When I'm not seeing patients, I'm reading medical journals, writing medical articles, looking up research, the journals on the computer. I really love what I do. And if you ask me why I come to work and why I'm here today in my office, it's really to help people. Sure, I do get paid. Not financially, but I get paid in gratification. When a patient comes back after his first visit and says to me, Dr. Block, I haven't felt this great in years. Thank you, thank you. It's good for my heart, it's good for my soul. The type of patients I see are all kinds. I want to be a doctor like the horse and buggy doctor. He was not a specialist. These days, there's fractionation in medicine. There is a heart doctor for the heart, a lung doctor for the lung, intestinal doctor for the intestines, a big toe doctor for the big toe. Maybe that patient has gout. It is a breakup of the patient, but who really takes care of the whole patient? And I want to be that doctor. I used to be a cardiologist. I'm actually board certified in internal medicine and urgent care, have a PhD in integrative medicine, but I want to do what that patient needs. Now, I can't do everything. I do require at times surgeons, gynecologists, urologists, but I do what I can for the patient and guide that individual to the right doctor, the right hospital, in the right time. I'm so fortunate to have the staff I have. After 50 years of medicine, 35 years of practice, 14 years or so of teaching, I found the right people to work with me. Behind every good man, there's a better woman. Behind every good doctor, there's a better staff. And I have a wonderful staff. Without them, I couldn't be the doctor I am today. I get a lot of calls from patients. Ask me this question and that question. But I practice my worst medicine over the telephone. For many years I took radio calls, but I really need to see the patient. It's not what the person says, but how they say it. For example, if somebody was having chest pain and they went like this, I know it's heartburn. If they went like this, it's a heart attack. If they went like this, it is angina. This is called the anginal salute. If they go like this, it's arthritis of the chest bone. So again, I really need to see that patient so I can do the very, very best I can for them. Why see me? I try my very, very best to do what I can for the individual, to make a diagnosis, to guide them in the right direction as far as treatment, to give them their outlook, their prognosis, but I can't do it without seeing you. Let me get a history on you, let me examine you, and I can't guarantee you I'll find the diagnosis or I'll cure you, but I'll guarantee you I'll give you my best. So I'm not an author. I didn't do well in high school. Did a little better in college because I had to get all A's to get in medical school. But the reason I write is I want to share my experiences, what I read, with the rest of the world. Putting it down in black and white. And by the way, when I wrote my first book, I wrote half of it by hand, dictated the rest of it. These days, with the advent of the computer, I can do this, and my next book, if I ever write one, I'm going to dictate it into the computer and just edit it. But I do this to share my knowledge with folks like you. I'm now in Tulsa. Been here for over 4 years. I practiced in a small town in Kansas prior to this. I wanted to be a small town country doctor, so I practiced in a town of 18,000. Prior to that, I taught at the university. But this is my first chance of practicing in a big city. And I love Tulsa. We have fantastic medical facilities. I can get an MRI at a drop of a hat. I can contact and have patients see within minutes of other specialists, and this is a great place with great people to practice. My office, 6048 South Sheridan, is the Old Springer Clinic. It's tough to schedule an appointment. There's usually a 2-3 week waiting list. My office number is 918-591-3891. Sometimes the phone doesn't get answered. My receptionist told me the other day we get 1,000 phone calls a day. Oh my gosh. And we try very, very hard, but sometimes it goes automatic and people leave a message. So if you really want to see me, please try again, and try still again. I think you'll find it's worth it. If you can't get through, don't have time to get through, visit my website, docblock.com. There's a place there to schedule an appointment. People often ask me how long I'm going to practice medicine. Gee, I don't know. I'm 74 years old, don't have to do this any longer, but I'll do it as long as I physically and mentally can. One of these days, Father Time will catch up with me. I might have a heart attack, maybe a stroke, become demented, but hopefully this is decades away. I try hard to practice what I preach, and I preach health for decades to come.